You don't always need antibiotics. It's common knowledge that drug antibiotics destroy your gut microbiome and cause gut dysbiosis. Taking pill probiotics helps a little, right diet and fermented foods helps the most, but sometimes it can take years to restore your gut health after taking antibiotics. And gut health impacts everything: your immunity, your energy, hormones, sleep, libido, digestion, your menstrual cycle, blood sugar and cortisol levels, your focus, and your mental health, to the point where even one course of drug antibiotics can send someone into a depressive, anxious, irritable, and unmotivated state because they impact your serotonin and dopamine levels. Now, if you have a life-threatening infection, or if you are in a lot of pain from one, or going in for surgery, then yes, the wisest choice is the antibiotics. For minor infections that you can catch in the early stages, though, you don't need to rush to antibiotics. There are a lot of herbs with antibiotic activity. Stay tuned because I'll let you know about what we keep in our home apothecary. Right now, we are enrolling the next cohort in family pharmacy. This is our beginner but really comprehensive program that lasts about 11 weeks, where you can make medicine with and for your kids, really helping you establish your own home apothecary so that you can address acute issues safely and responsibly and effectively at home. But here's where most folks fail with herbal medicine. So imagine going to the hospital for a scheduled surgery and the doctor says, "Hold up, I need to research which scalpel to use." You'd be like, "Excuse me, you're doing this now?" You'd be furious and feel very insecure about that doctor's abilities. Of all the places on the planet, the hospital is where you'd expect them to not only know about the scalpel, but have it ready. But this is exactly the situation you put yourself in when you expect results from plants that you don't know how to use. You won't be ready, so you'll rush to Google. You're not going to have whatever herbs come up in your search results, and even if you do, you probably won't take it right, and it's not going to be effective, and you're going to need the drug antibiotics anyway. And then you're going to be mad at the plants talking about herbs don't work. This is exactly why Family Pharmacy is open for enrollment right now. For as little as $47, you can learn about the right herbs and how to take them and stop reaching for unnecessary pills and giving your kids rounds of antibiotics that are hurting their health in the long run. No one plans to get an infection. You're not putting "get a UTI" on your calendar. If you want to use herbs and want them to be your first choice, whether it's for a headache, a stomach virus, cramps, colic, the flu, or a minor wound or tooth infection, then you have to be prepared. And preparation means that you're doing your research, stocking your home apothecary, coming up with your formulas and taking them, making your tinctures so they're ready, learning about dosage and how that changes when you're taking something for prevention versus something for an acute condition. And you're learning to recognize symptoms and understand symptom progression now. All of this needs to happen before you get sick. Just like you want your surgeon to be comfortable with the tools they're going to use before they cut you open, you need to learn your herbs. You need to establish an herbal practice so that when pain or illness brews, you're not scrambling. Just to name a few of the blends that we have for various types of infections, which you'll learn how to make inside Family Pharmacy, we have a triple extraction of Usnea, a juniper tincture, an echinacea root tincture ready. Year-round, they are ready to take internally for any type of infection. We have our garlic honey, our fire cider, and other oxymels ready, already made for respiratory and digestive issues. We have a plantain leaf, comfrey leaf, St. John's wort, lavender, and calendula infused oils ready for first aid, skin issues, and wound care so that those cuts, those bites, those scrapes, those stings don't get infected and abscessed. We have a throat spray with spices like thyme, oregano, sage, garlic for sore throats and strep, because most of our spices and aromatic plants have antibacterial activity. We have our UTEs blend on our website. I haven't had a UTI since I was pregnant 10 years ago, but we have the blend ready. We have vaginal suppositories with Oregon grapefruit and other herbs ready for bacterial vaginosis and yeast infections. I can't remember the last time I had a yeast infection. I think I was a teenager, but we have the medicine ready. Understanding how to use even just a few key herbs along with supportive diet, lifestyle, mindset changes can save you the headache of dealing with the inevitable drug side effects. Learn how to do this and so much more inside Family Pharmacy.